So it is going to be the Sims Speculum. So what do I know about the Sims Speculum? Now this is an instrument जो सबको पता है क्या होता है. This what we also call as the Sims. Now by the way, Sims Speculum is a very informal way of calling it. The ideal way of calling it is going to be Sims non-self-retaining metallic, because this is a metallic one. You also get a fiber one, the one that we use only once and then we dispose it. So this is a metallic one. Double-ended, double-sided, or double-bladed, anything that you can use. Speculum. So इसमें multiple important things. Sims उसका नाम. Non-self-retaining. Non-self-retaining मतलब it does not retain itself. You would require an assistant probably to do any procedure if you intend to do. So it is something that will require one more hand to be able to hold it if you are doing any procedure. Of course, it is metallic. Metallic से उसकी दो चीजें important हो जाती है. एक, it becomes reusable. Secondly, it has to be autoclaved. It has to be sterilized as a broader term. It is double-ended. It has two ends. उसका क्या significance है वो भी बताऊंगा. And speculum is something that we use as an instrument to just visualize any organ or to open up an organ. So in this scenario, it happens to be the vagina. So इसमें what are the important things that you can see? First of all is double-ended क्यों है? एक एंड है इसका, ये दूसरा एंड है. The reason is that in many sims that you get, Sims Speculum that you get, these two sizes are not the same. एक वाला थोड़ा बड़ा होता है, एक वाला थोड़ा छोटा होता है. So depending on the patient's vagina, the introital size, especially in younger women, adolescent women, if you have to do a speculum examination, you wouldn't rather do it in an unmarried female who has never had a sexual activity. But if you have to do it in a female who's young, or if you have to do it in a female who's postmenopausal, in a woman who's very old, she has got an atrophic vulvovaginitis, you would want to use a smaller size speculum. Whereas in a reproductive age female, especially someone who has had multiple vaginal deliveries, she has a lax vagina, and in fact the lax vagina is falling into your site of vision, you would require a broader end to use for the Sims Speculum, which is why a lot of Sims Speculum that you get will have different sizes of ऊपर का size और नीचे का size अलग. Also we get various speculums जिसमें ऊपर और नीचे का दोनों end का size same रहेगा, but then you get different sizes as an individual Sims Speculum. So वो भी हो सकता है, एक में भी हो सकता है, but that is one advantage of seeing it. The second thing that you see over here is this groove or wedge in it. You see ये जो wedge है अंदर का depression है. What is the use of this wedge? Basically जो ऐसा अंदर जाता है उसका use क्या है? There are two uses. First of all, this can serve as a place where I can collect all the vaginal secretions. So if the female has come to you with vaginal discharge, or in obstetrics, if I'm going to be talking about discharge, and it can also be amniotic fluid if the patient has complained of leaking per vaginum, that is rupture of membranes has happened, especially if it is preterm premature rupture of membranes. So the best way, the gold standard to confirm whether there's leaking is to visualize the leak. So how do you visualize it? You put in a Sims. Always remember, whenever a patient comes to you in obstetrics with complaints of, be it in first trimester, second or third trimester, with complaints of bleeding PV, or she comes to you with complaints of leaking per vaginum. In these patients, we have to remember that always do, after a per abdominal examination, do a PV examination. It is very important that you do a per speculum examination, especially in patients who have bleeding per vaginum, because she might be an undiagnosed case of placenta previa. She may not have a scan that was done earlier, and she can have placenta previa that is bleeding, and your vaginal examination can end up shearing all the vessels and causing torrential bleeding. Also, in a patient with leaking per vaginum, especially if it is PPRM, that is preterm premature rupture of membranes, you have to send a high vaginal swab. You have to send a swab of the fluid as well, the vaginal secretions, the amniotic fluid, so that you know if there is any onset of chorioamnionitis. The biggest reason of PPRM happens to be infection, and we want to know which infection is it, so that aage jaake you can give the baby and the mother the antibiotics as per the sensitivity. Which is why it is very important that you do not directly insert your finger. You put in a Sims Speculum for every single patient who comes to your emergency or in your ward with bleeding or leaking per vaginum as a complaint. So this area, this wedge, this depression helps in accumulating all the fluids over there. It can be leukorrhea, white discharge, bacterial vaginosis हो सकता है जिसको तुम्हें collect करने में बहुत help होगा, and then you can again send it for various examinations like hanging drop, और हैंगिंग ड्रॉप एग्जामिनेशन कर सकते हैं, या फिर जस्ट कल्चर सेंसिटिविटी के लिए भेज सकते हैं. So yes, that's area serves as a good area for collection of all those secretions. One more thing that you can collect in it is whenever you are doing a suction evacuation, basically you are doing a dilatation and evacuation for a missed abortion, of probably for something like molar pregnancy, you're doing suction and evacuation. So when you're doing it, you have placed a Sims Speculum. All the content, the products of conception that are coming from inside, if they need to be sent for culture sensitivity, if it's a septic abortion, or if you have to send it for histopathology, or if you have to send it like there's a patient who has BOH, that is bad obstetric history, and she has come to you with yet another abortion, it's a third or fourth abortion, and you have to send those products of conception for testing or for genetic testing, that is whole genome or whole exome sequencing. In that scenario, you need to collect those products while doing the procedure. When you evacuate the uterus of that missed abortion, the products inside, they will get accumulated over here, and then you can pick it up and then send for the desired investigation. So these are all the uses of being able to collect. If it was just a flat speculum, ऐसा अगर flat रहता तो सब कुछ नीचे बह जाता, सब निकल जाता. So that is one more advantage. Secondly, ये हो गया ये डिप्रेशन की बात. डिप्रेशन इज बेसिकली ये जो नीचे जा रहा है उसका. There's one more aspect to it. You see these edges are upturned. They are ऐसे upturned. Why are they upturned? So because whenever you're inserting, if this is your vagina and if you're inserting the instrument inside, if it is curved upwards, the lateral vaginal walls are not going to be injured. There are not going to be lacerations that are caused onto those walls because of this upward curvature. So basically it fits in the vagina and doesn't injure or doesn't hurt the vagina, and it also makes the female a little more comfortable while you're examining her with a speculum. So these are all the important points that you need to remember about every single end or every single blade of a Sims Speculum. Very important, these points.